Welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. By Friday, February 18th, more than 421 million confirmed cases of COVID-19 were recorded globally, with a death toll of over 5.8 million. In Nigeria, there were more than 254,000 confirmed cases, and deaths were 3,142. About 15% of adults in the country have had one COVID-19 vaccine, and 6.6% are fully vaccinated. Newborn jaundice has happened when a baby's skin and eyes turn yellow. It is very common and can occur when babies have a high level of bilirubin, a yellow pigment produced during normal breakdown of red blood cells. My guest is a consultant pediatrician at Pediatric Partners Hospital, Victoria Island, and a fellow of the West African College of Physicians. You're welcome to the show, Dr. Sophia Onia.
Thank you, Mary. Thank you, Mary.
Now let me ask you, red blood cells break down all the time,
Yes.
It happens all the time. They told us, I think, every 120 days or something like that.
In adults.
Our own red blood cells
Yes.
break down. We don't turn yellow. Our eyes don't turn yellow.
Okay.
So what's up with the baby turning yellow?
Okay. So in babies now, we're talking about neonatal jaundice. So these are babies that are less than 1 month old. So in these babies, their red cells, the lifespan of their own red cells are lower than in adults, which you just said, 220 days. But in babies, their lifespan is about 90 days. So in 90 days, this red cell starts breaking down through a series of processes. And then the end product of that breakdown is bilirubin. Now, the body tries to expel that bilirubin and take it out of the body. But the bilirubin is in a form where it cannot be taken out. It's in a unconjugated form.
Okay, so it's sort of toxic to the body?
So it's toxic to the body, and it doesn't pass through the body very well. It's fat soluble in that stage. So it first has to go to the liver, where it is changed, undergoes some processes. The liver then changes it into a conjugated form, where it is now water soluble. And then it pushes it into the bile duct. The bile duct is connected to the intestine, and then this bilirubin comes out in stool. In fact, it's part of what causes that yellow color, brown color of stool is because of this bilirubin. So if a problem occurs in any of this pathway from when the breakdown occurs and bilirubin is formed, if any problem occurs, then you can then start having a backlog or excess bilirubin in the body. For example, if a lot of bilirubin is being broken down, a lot of red cells are being broken down a lot, like what happens in infections or ABO incompatibility problems or resource incompatibility problems or even bacterial infections.
Okay, so let's break down what you're saying. When the baby's blood and the mother's blood don't agree,
yes,
that's
sometimes
the rhesus factor
yes,
problem.
sometimes that's one of the causes. Sometimes you may have problems with the liver itself, and the liver that is supposed to convert this bilirubin to a form where it can be taken out of the body is not functioning adequately, and then you have a backlog of bilirubin waiting to be processed. Or the liver has done its job and is supposed to pass it into the bile duct, but there's now an obstruction in that passage. So the bilirubin does not get to the intestine. Okay. Then you also begin to have a backlog. So, and all of this can cause problems in the body. Now, our concern is that the unconjugated type of bilirubin, that's before it is processed by the liver.
Broken down in the liver, yeah.
That type of bilirubin, it's neurotoxic. That means it can cause damage to the brain.
Okay.
Yes, in that form, when it is in excess and left untreated.
Okay, so that brings me to my next question, because this is a very, very detailed and complex thing now, the way you've explained it. But how soon does a baby, because lots of babies get jaundice.
Yes.
A lot of them.
Yes.
How soon after birth does the baby begin to show signs, of jaundice?
Okay, so like you say, a lot of babies have jaundice, and we have gone on to term it in in quotes, normal jaundice. There's some,
okay.
there's some jaundice that is normal
There's
jaundice.
some that is normal,
then there's
some is
none that
not
is
normal.
abnormal jaundice.
Definitely with the fever, blockage
and all that. So in a normal jaundice, treatment may not necessarily be required, but usually a baby will have jaundice, in this normal jaundice, within the first 2 to 3 days. Okay. You begin to see some level of jaundice. By the 5th day, it gets to a maximum. It wouldn't exceed a certain value. Usually this is about 12 milligram per DL in babies who are full term, that's like they completed 37 weeks of pregnancy. But in preterm babies, you can have a little bit as high as 15, and then it won't get beyond that.
And this is determined how?
We have to check it using blood. So we check their bilirubin levels. That is how we know the level of jaundice. Sometimes people look at the face, look at the body, you know, because this jaundice is discoloring the skin.
That's right.
But in pigmented skin, in dark skin,
it's difficult to find.
Tell, even among sometimes experienced, it can be difficult to tell. It's not very relied on. So you still have to do your blood count. So you can look at it, look at the baby and see that yellowish discoloration and say, okay, there's jaundice, but you still have to do the blood levels to know the exact level so that you begin to know what to do. But in normal jaundice, by 10 days, most of the time, in less than 2 weeks, that jaundice has cleared off. But in abnormal jaundice, where problems are occurring, other problems, you can have jaundice as early as within 24 hours of life, the first day.
Okay.
Jaundice can occur.
Abnormal.
Sometimes jaundice can occur in the first day of life. Sometimes it may not start so soon. It may start 2 to 3 days later, but it will be higher than that peak I told you about. It will be getting to dangerous levels, 15, 18, approaching 20 milligram per DL. At those levels, by the time it's getting to 20 milligram per DL and above that, you are worried because of the tendency and the increased risk for it to get into the brain.
First problem I'm seeing here is usually in Nigeria anyway, in 24 to 48 hours, the woman is sent home with her baby. So this jaundice is going to catch her at home. A lot of women don't even know the first thing. In fact, some will say, yeah, a bit yellow, yeah, it'll pass. But is that safe?
So what should happen is that's what we are doing here. We're trying to educate the public, you know. Before they get to that stage, this woman should be educated at the antenatal period. You know, when women are attending antenatal, they are supposed to learn about these things, know that jaundice can occur. This is what you can see. This is what to do if it occurs. Now, when mothers put to bed and they're about to be discharged, usually in a good setting, you shouldn't discharge on the first day. You shouldn't discharge even on the second day, at least after 24 hours. And then there's a screening. You should screen that child, check this bilirubin levels, serum bilirubin levels before the child goes home. And then you can know, okay, this child, the bilirubin levels are low, nothing so major, or it's approaching a little bit high, not so high, still mild, but mom, you need to bring this baby back in a day or 2 days' time.
Okay, so is this a new directive? Because, you know, when I had my children, the first visit was 6 weeks.
It's not a new directive. It's the norm pattern for wellness check for babies in the hospital when babies are being delivered. But some things pass through the cracks, and people don't pay attention to these things. I've heard of scenarios where the mom gets the information, the father did not get the information, or the mom gets the information, did not tell the father forgot to take them to the hospital. Or more commonly, what happens in Nigeria, they are waiting for naming ceremony.
Yes.
They want the naming ceremony to occur, which usually occurs sometimes in some cultures in the country.
On the 8th day.
On day 8. So sometimes you'll see these mothers have noticed this jaundice by day 5, day 4, day 5, day 6. For this naming ceremony, they've bought clothes, they've called makeup artists, they've called canopy, they've hired catering services. They are just waiting, you know, let's just finish this party, and they will come.
And they will
I've
come
had
to the
situations where
hospital.
they come to the hospital in the clothes, dressed in their regal attire. They just finished the naming ceremony and they come. Oh, the baby, this, that. And I'm like,
Okay.
this didn't just
I have
happen.
several questions, but let us start with the second problem I said that brings up. Is that, okay, let's say there's no follow-up visit. This is one of the people who has passed through the cracks, and the baby is yellow. It's a dangerous jaundice. She doesn't know. The baby is yellow. Is it still safe within a week?
Sorry, I didn't get that.
Now, you said normal jaundice usually happens on the second day. It usually goes off within a week. Everything is fine. So the mother is watching and everything is fine. But what if it is a dangerous jaundice and 7 days has passed? Is that fine? You have to answer after the break. Okay. Let's go for a short break.
All right.
We'll be back very soon. Welcome back. We're talking about neonatal jaundice. You can send email at moalale@channelstv.com. I'll take that again. moalale@channelstv.com. And you can send tweets at CTV_Mary A. Now, we are still talking about jaundice on Channels TV. It's Health Matters. I was saying, what if it's the dangerous kind of jaundice? It has occurred and the mom is waiting for the naming ceremony. She's going to go to the hospital after it. Is this dangerous?
It is very dangerous because jaundice can get to very high levels in the first week of life, and levels that can be toxic to the brain and cause permanent, irreversible brain damage, lifelong for the child.
So the message is go to the hospital if your child is yellow.
Yes.
How do you treat it?
So there are different methods. Like we said, there's the normal jaundice, but that is not what we focus on. Before you know that jaundice is normal, you have to check all the investigations and be sure that this jaundice is normal before you tell the mom that this jaundice is normal. So there are different ways to treat it. We use phototherapy. Phototherapy is a special type of light, not just a regular light. It's a special type of light. It helps the body to break down that jaundice in a way that it can then excrete it into the stools and sometimes into the urine. And also, when the jaundice levels are beyond a certain value, phototherapy may not be adequate anymore. You may need to do what we call exchange blood transfusion, where the baby's blood is exchanged with fresh blood that does not contain high levels of bilirubin. So
this is a lot for a mother to take.
Yes. So that is where education comes in. You don't just carry the baby and start doing these procedures. You have to explain to her. You have to sit her down. You have to counsel her. It's a family thing. If the father is there, you have to educate them, explain to them the complications that can arise if treatment is not being carried out, and the fact that the treatment is simple. It's actually simple and easy and available.
You just need to cover the baby's eyes when you do that.
Yes, when we do the lights, you cover the baby's eyes because it can damage the eyes. It can also damage the reproductive organs. So the baby has to wear diaper.
Oh, is that why they wear the diaper?
Yes, that's why they wear the diaper. Especially for boys. You know, for boys, the testis is outside the body, so you have to cover the boys up. Then the lights can also cause some dehydration because of the heat. So you make sure that they're on fluids, as well as sometimes it may make the baby's skin a little bit dark, but that wears away over time. There's no long-term after effects.
Good to know.
Phototherapy.
I understand that there are some myths involved, that people believe certain things. Take us through that.
Okay, so these are life tales that I've heard. You will hear people say, oh, if a baby wears yellow dress, he will have jaundice. So you see mothers coming to the hospital, they will not buy any item of a yellow dress or yellow flannel for the baby. That is wrong. Yellow dresses do not cause jaundice. Some will say if jaundice occurs, use pawpaw water. I don't know how they mix this pawpaw water. Bath the baby with pawpaw water and give the baby to drink. And you know that's dangerous because at that time, the baby should be taking only breast milk. And, you know, it's not even going to cure the jaundice. So, and you are then going to introduce infections and other things to the baby. Then some other people will say, oh, let's give medicine, Ampiclox, and it's not going to treat the jaundice. Some will say, oh, let's use sunlight. In fact, that was how phototherapy was found out in the 1950s in UK, where a nurse stumbled upon using sunlight, taking babies out for fresh air, and found out that when these babies were taken out, they had lower bilirubin levels. But then it's not as effective as phototherapy.
At this point, I've got to stop you. This has been so interesting. Thank you so much for coming to the show.
Thank you.
I've loved every bit of it, and I believe the viewers have too.
Thank you, Mary.
Thanks for coming.
Thank you for having me. Thank you.
Now, it's estimated that about 60,000 Nigerians spend an average of $20,000 per trip outside Nigeria for treatment every single year. The reasons are not far-fetched. People are looking for quality care with state-of-the-art equipment and experienced medical personnel. Some medical institutions and people are stepping up to the plate, like Evercare Hospital at Lekki, which has conducted several groundbreaking procedures in a short space of time. Here's the report.
Within a period of 1 month, Evercare Hospital Lekki has recorded 3 groundbreaking moments. Open heart surgeries, spine surgeries, and an advanced first-of-its-kind pediatric surgery were all carried out at this state-of-the-art facility. The hospital's way of informing the public that they are more than capable to provide quality and accessible health care to patients.
Another milestone for us is the commencement of spine surgeries in the facility, with specialties in interventional spinal injections, decompression, and instrumental fusion surgeries. We have also recently carried out an advanced first-of-its-kind pediatric surgery. This was the first laparoscopic thoracoscopic repair of esophageal atresia. This was done on a 3-day-old infant with a first-of-its-kind technique with this surgery in Nigeria and West Africa.
In our country and actually in West Africa, we usually make incisions on the chest wall of these patients, and we access the esophagus to repair the atresia. This is very devastating for the baby who is newly born and cannot swallow his or her own saliva. This will lead to a division of the muscles of the chest, after which this patient will have a turbulent post-operative period usually, and when they make it, they tend to have chest wall deformities. However, with minimal access, which we did at Evercare, there is little or no telltale signs that this patient had surgery.
The 165-bed multi-specialty tertiary care private hospital is now fully equipped with modern infrastructure and surgical equipment.
We started last year with surgeries which was done on the lumbar spine for patients who develop infection in the spine, which causes instability of the spine and severe pain, preventing them from ambulation. Another case which was done is a very interesting case when the patient came with a difficulty of walking and using the hands, cannot feed herself, cannot hold anything in her hands. We came and removed whole vertebra in a cervical spine, which was fully filled with cancerous cells. Then we took the bone from the patient pelvis bone and inserted in the cervical spine and put a plate and screws to hold the spine together. The surgery went extremely well. The patient was discharged from the hospital in 1 week.
There is also assurance from the medical team to provide exceptional care for patients.
We have all the infrastructure which is required for the care in ICU. We have that. We have trained our staff in to look after these patients, and the good results will only come with full teamwork. We have excellent physiotherapy department.
One of the greatest challenges patients have about cardiac surgery is they've heard that, look, this is a major surgery and people die, and people can die from it. Everywhere in the world, that fear is always there because you have to be connected to a bypass machine. So the bypass machine takes over the function of the heart and the lungs. So we stop the heart, stop the lungs, and the bypass does everything, and then we can now work on the heart. And when we finish, we start the heart again, return the function of the heart and the lungs back to the patient. So when I was discussing this with the patient, I remember vividly, this man, he broke down and started crying. And the wife was consoling him. He said if he dies, he does not know what the wife would do because the wife can't live without him. After the surgery, 5 days later, I think he was discharged. And yesterday we still saw him. He's doing well. He's gone back to work. The beauty of this is that people can return to their normal life after the surgeries.
With the clinical milestones achieved by Evercare Hospital Lekki within the short period of its commissioning, the healthcare facility is on its way to transforming the traditional model of treatment by ensuring quality improvement.
And that's how many Nigerians are changing the game and changing the story in Nigeria. Kudos to them. I see your questions. We'll continue this conversation after the show. Thanks for watching. I am Mary Alale Yusuf.